Good morning everyone. Welcome back to my YouTube video channel. Today I will explain to you what the important reason why when you have the tooth removed, the dentists nowadays suggest you to have the bone graft material and what the benefit of having the bone graft or for the socket reservation and what exactly does that mean. Okay, these are some of the example of the edentulous teeth. There's no more teeth here on this case on the bottom tooth of one of the case, and this is another case where there's some teeth left, but there is a edentulous space here, and this is another case of the upper arch where there is some defect part and some root left behind. So I want to talk to you because a lot of patients have a question why we need to get the bone graft onto the tooth extraction site. Well, one of the reasons is that if you put the bone graft on the extraction site, you will be able to preserve the bone. You can take a look at this root part right here. So this root, the tooth here is broken, but even though it's broken, but we haven't taken out the root completely, and you can see the bulkiness of the bone right here versus the shrinkage of the missing tooth part right here. There's a really missing part right here. Same thing here, when the tooth missing, there is a shrinkage of the bone due to the the modification of the alveolar bone is trying to heal the tissue up after the tooth removed. So the advantage of having the tooth extraction and the bone graft right on the socket area is to preserve the volume of the bone right this. As you can see, if you put the bone right where the socket is, you're going to be able to preserve the bone, and this is how it looked like. And this is the second example. Same thing, the root haven't been removed. Imagine if you take out the root, you put a bone right in here, you'll be able to preserve the volume of the bone right here. And why we need that? Well, there's couple reasons. If you're gonna do the implant, you have the bone volume that you can put the implant back. In this particular area here, wasn't any bone reservation, and the patient didn't have a chance to do it. The bone shrinking, and now you have a very limited volume of the bone, so you can put denture or implant, which is a lot more difficult. Same thing right here. If you can see that this is a rotten root here, but we haven't taken out the root yet, and you still see that there's still a volume of bone around this area here compared to the adjacent tooth. But imagine if you take this out and you don't have bone graft, the bone will shrink in just like on this side of the patient mouth. So it is very crucial that if you take out a tooth and you don't have bone graft, you're gonna have this kind of bone defect. Another case right here, same patient taking out a tooth. There must be a very traumatic procedure where the patient had to remove these two molar area, and now you can see there is not a lot of bone high left, very shrinking bone level, and same thing on this side of the patient mouth. So now if the patient wants an implant, it's going to be difficult because we don't have enough bone high to do the job. So that leads to the recommendation that whenever you have a tooth removed, recommend the bone graft socket bone reservation, or they call bone graft procedure, to preserve the bone high. So that's where we can put the implant on there. The same thing here. This is another case where a patient. This is a case where I managed the patient. He got some teeth removed, and I recommend him bone graft reservation. And you can see how much bone level, bone height, and bone width is available for denture and implant. So this is a successful bone reservation case where we can do either denture only or implant over denture, or even single implant. We have enough bone to do the implant. So that's why it is very important to have a general information, the option available for you to choose what better for you. As unfortunately in America, the cost of dentistry or medical expense is extremely expensive, but other country, these procedures are considered very common, and it's not the question whether we should do it, but it's just a matter of the choice. If the patient want to do it, whether it's because of the religion purpose or their belief, anything like that. But in America, so much of these material, it does cost. The cost of managing the business, the cost of dental material is so expensive. I wish we can try to turn around the situation in America a better way. But anyway, again, just video, it basically want to stress you guys about the benefit of bone graft and non-bone graft when you take out a tooth. Just quickly recap again. No bone grafts nowadays, a very resorb bone right there, and if you put the bone graft here, you would be able to preserve the bone like that. And you look at this view, same thing right here. If you put a bone graft here, you'll be able to preserve that right there too. No bone grafts, shrinkage of the bone on the facial aspect of the alveolar ridge. This give the dentist the tough time to do denture or implant. So again, we encourage patients to receive bone graft. This is a case where there is no bone graft reservation. There's shrinkage of bone height and bone width, very difficult for dentists to restore in the proper function. This is the case where a lot of bone graft were placed in when we take the tooth out. So that's why the bone will preserve very nice bone volume for bone height and bone width for denture. Thanks you again for watching. Have a great day. Bye bye, everyone. And don't forget to subscribe my channel to learn more about dentistry related. Bye bye.